Hi, this is Angelique Millette, pediatric sleep consultant and parent educator, and today I'm going to be talking about quality bedtimes. There's new research that's come out that shows us that it's the quality of the bedtime. It's the time that you spend with your little one in those few minutes before the lights go out and the hour before you separate from your little one. It's the quality of that bedtime that actually helps your little one to separate from you and to settle and sleep soundly at night. Now, if you think about sleep, we're really focused on, when we talk about infant or child sleep, we're really focused on how many hours your little one is sleeping, if they're waking up at night, if they need your help to get to sleep at night. But in fact, sleep has a lot more to do with relationship. And the new research is showing this more and more every day, that sleep, especially when it comes to your child, sleep has a lot to do with relationship. It's your child's relationship with you that's enduring, and that bedtime routine is enduring. That will be the routine that continues over the years. It'll be a touchstone for you and your child where you can connect at the end of the day. You can share stories about your child's day. That's starting in those first few months when you introduce the bedtime routine. I start the bedtime routine between 6 to 12 weeks. Even when they're newborn, they're developing these sorts of routines for settling and separating from you. And I find that the earlier that we start those kinds of routines, the more helpful it is to parents and babies as they start to put in these routines that help them with sleep. So the quality of the bedtime basically means that you're looking to do things that help your child to settle and to separate from you. And that could be something like holding them in your arms, making eye contact, talking to them. It sounds a little bit woo-woo, like, well, baby would actually understand a parent talking to them. They in fact do. And we've woefully underestimated how much babies understand. They certainly don't understand those words early on, but they pick up body language from us. They have this ability to adapt very quickly to picking up inflection and tone and pitch and the shape of our eyes and the way that our mouth is moving, and that gives them information about safety and security, bonding, loving interaction with them. So you want to think about that at bedtime. For a lot of us, if our little ones are having a hard time at bedtime, the bedtime can kind of be fraught with some anxiety. Maybe we have other kids that need our attention at the end of the day. Maybe we have a big work project. Maybe we just are tired and we need a break and we haven't had dinner and it's now past 8 o'clock at night. And these are the realities of our lives and our routines. Try to spend a good 5 or 10 minutes at that bedtime routine right before you separate to just look in your baby or your child's eyes, talk to them about their sleep, let them know that even when they're sleeping, you're never far away, they're safe, they're loved. Mommy or daddy's love is always there around them as they're sleeping. And I do this with babies, and I do this a lot with toddlers, especially toddlers who are going through particularly clingy developmental stages, or they're developing a fear of the dark, or they've just moved to a toddler bed. Really put into words your love for your child, the things that you noticed about the changes that they made that day, the milestones that they adapted to, and really put into words a lot of snuggles, kisses, cuddles, and really enjoy that time with them, those last 5 or 10 minutes before the lights go out. You can do this in addition to reading books. You can do this in addition to singing a lullaby or two, but just especially those last few minutes before the light goes out, it's that quality bedtime. That's the end of this quick tips vid about bedtimes and quality bedtimes. Hope you've enjoyed the video. Thanks so much. Hey, this is Angelique Millette, a pediatric sleep consultant and parent educator. And I'm going to talk about the transition from the crib to a toddler bed or a child's bed. So typically that transition happens between the time your child is aged maybe 2 to 3. Impulse control develops around the time your child is 2.5. Some children are already developing it before 2.5, but for most it happens after 2.5 to age 3 and then on. And you'll know that they're starting to develop impulse control because they'll be able to respond to rewards and consequences, and you'll just start to see that there's some delay in gratification, that they'll be able to sort of delay their needs for a sort of a result or a reward. So if you have to make the transition out of the crib, earlier than say 2.5, 3, and that can happen because you have a toddler who's climbing out of the crib, which could happen between the 18 to 22-month developmental milestone. It's a particularly big time for language acquisition. They're getting up to 10 new words per day, and as that's happening, they just become more clingy. They may want to climb out of the crib. So if you're finding that you're kind of having to make this transition out of the crib sooner than you would like to, you have a few options. The first option is simply using the conversion crib. And a conversion crib is when you remove one side of the crib. Usually there's a piece that as you remove the side of the crib, you replace it with it's like a half, it almost looks like a half crib side. It's almost like a little gate, but there's a little hole to it. And that's a conversion crib, and that would permit your child to be able to get out of the toddler bed if they needed to at night, which once they start to do some potty learning, they're going to need to do that. If you have to use the conversion style crib, if that's the setup arrangement that you have, basically what you do is from one night to the next, you just remove the side, you put on the conversion side, and then you basically start bedtime routine as you normally would. Now for most toddlers, they are actually going to stay in bed, which sounds surprising, but for some reason they find that the side rail is a limit and they'll stay there. But for some toddlers, they just won't. They just don't have the impulse control. They're just really excited by that freedom and that space, and they will get out of their beds at night, and you'll find them wandering the hallways. You might find them in your room or in your bed. And for those parents that want to help their children to sleep in their beds for the whole night, you can use a method like the chair mattress method to help them stay in their beds for the whole night. I won't be able to go into too many details about that method, but I do have that method on my website under the webinar, the archived webinars. If you look under the topic toddler sleep regressions, I discuss the chair mattress method and how to use it specifically for a child who's getting out of their bed at night. If you don't use the conversion crib, the other option that you have is to set up a mattress in your child's room. And I like the mattress option because you can sit on the mattress with your child, and maybe the week before you actually move them out of the crib, you can do the bedtime routine on the mattress, do some snuggles there in the evening. But after you finish the bedtime routine, put them down in their crib at night, so they're still sleeping in their crib. Do that for about a week. So they're starting to get used to getting their needs met and having some snuggle time with you on their bed. They're not quite sleeping there yet, but then after about a week of having that snuggle and that bonding routine at bedtime, then get rid of the crib and then just have them sleep exclusively in their new bed. And again, the same rule applies there with the new beds. Some toddlers will just stay on their new mattress. They won't really get out of bed. Others won't be able to. They just get very excited by the new space. They get out of bed at night. You can think about putting up a baby gate, but I would recommend that you take a look at the toddler sleep regression webinar on my website to learn more about this chair mattress method. It's a great method if you do have a little one who's getting out of bed at night. Thanks so much. That wraps up this quick tips video. Hey, this is Angelique Millette, a pediatric sleep consultant and parent educator, and I'm going to talk a little bit about toddler sleep regressions. It's really a big topic. I could spend hours and hours talking about it, but I think what I want to focus today's quick tip sleep video on is just some of the highlights of toddler sleep regressions, because I think that it can help to kind of put things into perspective for parents. So one of the challenges that your toddler is going through is that they're becoming a little independent little person. And that's great news. That's exactly what you're after, is that they're really trying to express themselves and verbalize their needs. They are trying to put into words their emotions, their feelings. All of that is really happening in a big way starting around 18 to 22 months, and then it really just continues and continues and continues. So one of the reasons that your toddler's sleep will regress is that they will become, they start to have a greater imagination. Fear of the dark starts to develop around age 2. Impulse control starts to develop around age 2.5, and these are proximate times. So you have this fear of the dark, that starts around age 2. Impulse control, which means that they could respond to rewards or consequences. They could be coaxed to stay in bed or put themselves to sleep with your encouragement. That starts around age 2.5, 3. The other thing that's really happening around age 2 is that their imagination is just skyrocketing. It's really going through the roof, which is great. What you start to see is this development of a lot of pretend play where you'll see them kind of putter about their toys, and they'll tell stories about the experiences that they had at the park, maybe at a daycare or preschool program, maybe with a younger sibling. They start to put that into imaginative play, and as they're playing, they work out feelings, emotions, their issues. It's a great thing that your toddler is doing that. The more that they can do that, the easier it is for them to actually sleep at night. So encourage that pretend play. You can't really discourage it. That's what they want to do anyway. But it does mean that as their imagination and creativity starts to increase, that they may develop fears and phobias, and you would start to see the development of these nightmares. Common topics that I see in a child's nightmare would be spiders, monsters, dinosaurs, whales, something big that might be coming after your child. Those are all very normal, healthy kinds of topics or nightmares for your child to have, but it would wake them up at night, and they may have a fear of going back to sleep. So you could see that there's this rich interplay happening in your child's sense of themselves, their emotional makeup, their imagination, and all that plays a part in sleep regressions. And they're frankly becoming some normal kinds of insecurity and clinginess where they just really need you a lot more. So I just want to put that in a context so that parents can really understand that when it appears that their child is maybe being naughty or not paying attention at bedtime or really pushing the limits, in fact, this rich tapestry of development and your child's budding independence and imagination, all that is playing a part in their ability to feel safe and secure and put themselves to sleep at bedtime, and then feel safe and secure to put themselves back to sleep in the middle of the night. It really helps us better understand why they would get out of bed at night and look for you, why they would get out or wake up at night and call for you. All of that is a normal part of a child who's feeling a little bit more insecure and clingy due to all these big changes that they're going through. So I hope that's helpful for you. It's been great to share that information with you. And then you can look on my website to find out a little bit more about how to use the chair mattress method. It's under the topic Toddler Sleep Regressions in the archive webinars, and it talks all about how to help a toddler who's getting out of bed at night, how to help them stay in their bed at night without making them feel more clingy and insecure and anxious. Thanks so much. Hi parents, Angelique Millette here with a sleep tips video. Today's topic is the 18 to 22 month developmental milestone. I wanted to talk about this today because it happens to be the second most common time for parents to reach out to me and enlist my help. The reason is that it's such a serious sleep regression that toddlers go through that they may go from sleeping very well at night to frankly not being able to sleep at all. They may have bedtime settling issues, waking up in the middle of the night for several hours, or early morning waking. Some of them stop napping. So the period of time from 18 to 22 months is a period of language acquisition, which basically means that your toddler is going to be talking a lot or trying to talk a lot, and they may be gaining up to 10 new words per day. It's an explosion of vocabulary, which is really cool, really fun. They'll understand a lot more than they ever have. They'll be trying out words, but it makes it really difficult for them to sleep because all they want to do is talk and practice talking. So the period of time when they are supposed to be sleeping is this time for integrating all these new words, cataloging them to the library, like I like to say. And so instead of sleeping, they just stay up in the middle of the night and talk. It's like their brains are on espresso, and they're firing and wiring all this new information, and they just simply can't sleep. So during that period of time, they may become more clingy. For some toddlers, they stop sleeping for a few nights or maybe a week. And then for other toddlers, they'll stop sleeping for sometimes several weeks. I've even seen a handful of toddlers stop sleeping for 4 to 8 weeks.
So it's a mighty big regression that they have around sleep. It's a normal regression, but it is a big regression, and as a result, they have a very difficult time sleeping. And sometimes the only method that works is a parent presence method. Sleep training methods tend to not work very well because of the clinginess. So keep that in mind and know that it's a normal regression. Things do get back on track, and for some toddlers, you will have to introduce a parent presence method to help their sleep get back on track again. Thanks so much. This concludes the quick tips for the 18 to 22 month sleep regression.